Hello, everyone. I want to welcome you to the 2020 State of Health and Wellness in Buckeye Nation. My name is Josh Wynn. I'm the program manager for Buckeye Wellness out of the Office of the Chief Wellness Officer here at Ohio State. Today, we'll be celebrating wellness across the university by listening to remarks from our senior leadership, highlighting successes from our Buckeye Wellness Innovators, and announcing the Wellness Leadership Award recipients for 2020. Today's theme, as you can see here on the screen, is Buckeye's Strength Through Resiliency. So we'll be highlighting all the efforts that we have done to improve the mental health of our faculty, staff, and students. To kick this off, I'd like to do a nice activity with everyone that is tuning in to address or to figure out what makes us Buckeyes so resilient. So if you can, we're going to click this link here, and actually I'll put it in David just put it in the chat box. But I want you to choose one word that has helped you stay resilient or describes what resiliency is to you over the past several months. Okay, so take about 2 minutes or so to think of what that word is, and then we'll share the nice word cloud with everyone. Additionally, we have the code there, 805334-5, and we can go from there. So I can see these answers starting to pour in. These are great. Family, faith, exercise, hope, strength. Love that. So continue to use that and then put that one word of what resiliency means to you. And we'll be sharing this at the end of our presentation with you so you can share to your friends and families and other colleagues. A couple housekeeping items before we get started. Please use the chat box if you need anything immediate from our panelists. Otherwise, you can use the Q&A section as well. We do have a closed captioning option for those that need that. It's going to be at the bottom of your Zoom call. It'll say closed captioning or CC. Feel free to click on that, and the words will pop up there. We're also using the hashtag HealthyBuckeyes2020 on all of our social media channels. So if you're tweeting during this time or posting a picture on Instagram, feel free to use that hashtag. So with that being said, it's my honor to introduce our first presenter, none other than our Vice President for Health Promotion and University Chief Wellness Officer, Dr. Melnyk.
OH, welcome. Thank you, Josh. And I first want to thank members of my Buckeye Wellness team, IT, marketing and communications for working so hard on getting this annual State of Health and Wellness completely organized today. I want everybody to stay alert, and I want us to decrease our risk of cardiac disease by standing during much of today's presentation. So if you are sitting, I would ask you to stand at least for portions of this presentation today. I really want to thank and show great appreciation for our awesome One University Health and Wellness team. I want you to know these individuals, they really are so dedicated to promoting health and well-being throughout our university so that all our Buckeyes can reach our optimal state of health and well-being. I also want to thank each and every one of you. You have so shown strength and resiliency during this unprecedented year. I want to thank each and every one of you for your terrific continued efforts on behalf of our fantastic university. As you know, there is a lot that we could be negative about right now. And I want to share a word of caution. Please do limit your social media and news media, because too much of negative news going in is only going to stress us more and make us more anxious. Go to credible websites like the CDC or Ohio Department of Health to get daily updates, but please do restrict your time on negative media as well as social media. Although there is a lot we could feel negative about right now, there also is so much that we have here as a member of our Buckeye family to be positive about. Our people are our greatest treasure, and that is why Ohio State continues to invest in the health and well-being of our entire Buckeye family. This past year, we had fantastic recognition from the National Academy of Medicine. They highlighted us as one of 2 institutions in the country that were model examples and cultures of wellness. That wouldn't have been possible without each and every one of you and our fantastic wellness team. COVID-19 is triggering a lot of mental health problems right now, as well as unhealthy lifestyle behaviors. So if you are feeling lonely, if you are feeling Zoom fatigued, beginning to experience burnout, sleep difficulties, you are not alone. But the important thing is to recognize, to be self-aware that you're experiencing these symptoms and to get help if you need it. A third of Americans are now showing signs of clinical anxiety or depression. And according to a report that just came out this past week, 11% of adults seriously considered suicide in June. What's even more alarming is that 25% of 18 or 24-year-olds thought seriously about suicide. That is the majority of our college-age population. So this year, we have placed increased emphasis on mental health and well-being, recognizing the chronic stress that this year has brought. So I urge you, if you are experiencing symptoms of anxiety, stress, or depression, and it's interfering with your concentration, your judgment, your ability to function, this is the point you need to seek some help. Please don't hesitate to do that. We must slash mental health stigma here at Ohio State. There is nothing to be ashamed of. If at some point you need help to cope, we've got a fantastic employee assistance program. Please don't hesitate to reach out to them if you need it. So right after COVID struck the United States, we team huddled. We said, what can we do to really help our faculty, our staff, and our students? We created an acronym called COPE with COVID. That is a friendly reminder of evidence-based techniques that we can use to cope better with the uncertainties, the negativity that we are experiencing today. I'd like to remind everybody to remember cope with COVID. C, focus on what you can control, not the things that we can't. Open up. Share your emotions, your feelings with somebody you trust. And if you don't have a person that you feel you can do that with, write it in a journal. Practice daily stress reduction techniques, including physical activity. Keep yourself moving more and sitting less. Not only will that boost your immune system, but it will help you to reduce your stress and anxiety. Mindfulness, evidence shows it really helps. Worry does not help. So if you find yourself worrying, pull yourself back to the present moment. Turn your head slowly from left to right, observing what you are seeing, feeling, experiencing. Count your blessings daily. Gratitude helps, and it's a quick, evidence-based tactic that really helps us to reduce stress, anxiety, and depression. When you start to feel stressed, anxious, or depressed, stop and think to yourself, what was just going through my mind? And is this pattern of negative thinking helpful? 99% of the time, the answer is going to be no. So catch those negative thoughts, turn them around to the positive so you feel emotionally better. Volunteer to help others. Reach out to just one colleague, friend, or family member daily. Identify helpful supports and resources. I'll talk about those more later, and we've all got to do our part to prevent the spread of the virus through hand washing, 20 seconds. That's a great time to take some big, deep abdominal deep breaths, wearing our masks, physical distancing. We can do this. We're Buckeyes. We're committed to each other. So we launched a Stay Calm and Well series in March, soon after the pandemic started. We took a pulse survey to all of our faculty, staff, and graduate students who were participating. We had an average of 100 people who joined us weekly for this series. But in that last week in May, 63% of participants reported feeling nervous, anxious, or on edge several days to nearly every day during that last week. And 37% reported feeling down or depressed. We asked people, what are you worried about? Our responses filled 40 pages every single week. People wrote they worried about contracting COVID-19, the unknown, financial insecurity, balancing work and home life. This is an incredibly stressful time for parents with young children trying to balance work demands along with helping their children with their schoolwork. If you're a supervisor or manager or leader listening today, please give your faculty and staff permission to engage in wellness activities during their day. Give them permission to take wellness recovery breaks. They need to hear that it's okay for them to do that, so we don't get to a point where they're burning out. Well, now I want to present some of our 2019 health and wellness data. As you will see on this slide, about 71% of our faculty and staff completed their PHAs last year. If you have not done your PHA this year, I'd really encourage you within the next couple of days, say, I'm going to go and do that. This year, we recognize that it could be difficult for people to get verified screenings. We want you to still get your screenings, but if you don't, you won't be penalized at all for not doing that. We want you, though, to complete the PHA. That will be still a requirement. Let's take a look at weight, blood pressure, normal hemoglobin A1C, which is a great predictor of blood glucose control, and then total cholesterol. Over the years, and you'll see the patterns since 2015, we have had great accomplishment with hemoglobin A1C numbers. In fact, when we started in 2015, only 78% of our faculty and staff had normal A1C levels. That's up to 89%. What we really are trying to do is target these people who are in this pre-diabetes state. We want to help you with nutrition, physical activity, stress reduction, so you don't end up going over the fence to a full diabetic state. In terms of total cholesterol, we made improvements from last year to this year. What is worrisome, though, is blood pressure. We are seeing a decline in the number of our faculty and staff with normal blood pressures. Blood pressure control is so incredibly important. It is the number one predictor of heart attack and stroke. So again, us targeting people who have high blood pressure, pre-hypertension, helping them get more physically active, eat healthier, manage their stress to decrease their risk of heart attack and stroke is so imperative. We've also seen a decline somewhat in the number of faculty and staff who have normal weights. We don't like to over-focus with anybody on weight, but I want to share when people cross that line from overweight to obesity, that's when people experience so many more problems with diabetes, high blood pressure. So again, I want to focus on behaviors. Behaviors are still the number one cause of death and disease in this country. If we can get everybody in Buckeye Nation to just get a little bit more physically active, to eat 5 fruits and veggies a day, don't smoke. If you drink alcohol, limit it to 1 drink a day and sleep 7 hours a night, along with reduce your stress by engaging in stress reduction techniques daily, we could eliminate 80% of chronic disease. So again, we in Buckeye Nation have to focus on these behaviors, because if we can get people doing these behaviors more, we will see obesity coming back down to overweight coming back down to normal weight. And we will also see improvements in blood pressure, total cholesterol. The CDC this past year really put out a big press release because the decline in stroke deaths has slowed since 2013 because of lack of improvement in blood pressure control and increases in diabetes. Then if you take a look at Ohio, we have had more stroke deaths in younger age people between 35 and 64. Our underrepresented populations are even at bigger risk, which is why a focus on our social determinants is so important. We know underrepresented populations are also dying of higher rates from COVID-19. We talked about hemoglobin A1C. I'm really excited when we look at this number. This is really great. But again, we need to stay focused on helping people who have pre-diabetes get more active, eat healthier, reduce their stress, to move them back to normal hemoglobin A1C levels. Now I'm going to talk about our health and productivity index. We work with a company called IBM Watson. They developed a score based on 10 leading health indicators that include things like weight, hemoglobin A1C, blood pressure, stress, depression, anxiety, alcohol use. So we get a score of 0 to 100. Every 5 points that we improve, that results in 3% less medical costs, fewer absenteeism days, and fewer presenteeism days. Presenteeism, meaning people show up to work, but maybe they're not mentally there, so they can't be as engaged and productive. Well, the really good news for us as a university is our HPI score is above the benchmark score of 66. In 2017, we had an HPI score of 60. We have improved by 8 points, which is fantastic. Thank all of you for what you do to contribute to us doing well on this HPI index. But stress and chronic health issues are by far the greatest source of presenteeism and absenteeism impacting our workforce. We do cuts wherever there are 100 or more faculty and staff. We can give that unit or college their score. And our leaders make several presentations every single fall to college deans, their executive teams, vice presidents, their executive teams, and show them de-identified aggregate data of how their unit is doing on these 10 leading health indicators. So the good news for Ohio State, we're 3% higher in score than the 7 other benchmark institutions. But we have some work to do in some of our units. We have one unit who has a score of 49. There are some below that benchmark of 66. We can help those colleges, those hospitals, by focusing on areas where they really need help, sending in our university-wide wellness team to help them help their people. One thing that is alarming that I want to point out, which is why we are so focused on mental health and well-being. Our depression prevalence continues to be twice as high as our benchmarks for both 2018, 2019, which is why we've got to have a strong mental health and resiliency focus. We've got to help everybody build their cognitive behavioral skills, their mindfulness skills, their resiliency skills to get our risk prevalence down for depression and anxiety. So here are a few areas where, again, we are really doing great. For instance, physical inactivity. Look how beautifully we have done with getting people more physically active, but we have more work to do. High stress, again, we're really focused on evidence-based tactics to help people reduce their stress. Here is part of this data that I was jumping up and down about when I saw it. We looked at our Buckeyes who we have had consistently enrolled in our health plan over the last 3 years. And I'm really excited to share that those people who have been with us for 3 years, their HPI score is 3 points higher than the overall score of the university. And that really tells me we are being more successful in getting to our people, helping them engage more in healthy lifestyle behaviors. This is our people's self-reported anxiety since 2014. You will see we're creeping back up again. Not surprising in the year of this pandemic. Here's other, though, despite that and the increased prevalence, I am really excited to see that 32% of our faculty and staff, compared to 52% last year, say that stress impaired their ability to function at work. That tells me we are being more successful at getting help where help is needed, but we need to continue doing that because our depression rate, as you will see on this particular slide, remains high, and I anticipate a continuation of that as the stressor of the pandemic continues to go on. 89% of our faculty and staff report their health is good to excellent. I really want to get this to the point where 100% of our Buckeyes say they're in good to excellent health. We developed a valid and reliable scale to measure wellness culture. We published that scale because what we have learned at this university and throughout the country is if people perceive they live in a culture that supports their health and well-being, they really engage better in healthy lifestyle behaviors and their outcomes are much better. So I'm really happy to share this first outcome, and that is 81% of our faculty and staff truly believe that OSU supports them in their efforts to achieve a healthy lifestyle. 85% of our faculty and staff think it is important for Ohio State to promote the health and wellness of our faculty, staff, and students. And we did. It's very character building to get this much of a bump in our large population. But I'm really excited to see that 2/3 of our faculty and staff feel we have a culture and an environment that promotes their health and wellness. But I also want to see that get to 100%. We are still working hard to make our communications clear. We are still working hard to make what we do readily accessible. When the pandemic struck, our teams worked so hard to offer what we do virtually. Our employee assistance program, health coaches in our health plan, our health athlete trainers, Mind Strong, all of those programs went to virtual so our people could have access to them. We want it to be easy, the norm for people to engage in all of the fantastic programming that we have available. I also work consistently with our leadership across the university to make sure they are actively supporting, promoting health and well-being, because their promotion of it, if they walk the talk, and that includes our managers and supervisors, our people will follow suit. So looking at our lifestyle behaviors, we do have an issue with increased alcohol use. In fact, 27% of our male faculty and staff said they have 4 or more drinks on occasion. Females have 3 or more drinks on occasion, about 22%. 27% of our faculty and staff engage in the recommended 150 minutes of moderate physical activity per week. So again, we need to focus on behaviors, because if we can get everybody to engage in just these few healthy lifestyle behaviors, we can change and improve our outcomes, our chronic disease. Right now, about 2/3 of our faculty and staff say their direct supervisor supports their health and well-being goals. Again, we're going to target managers and supervisors this year with programming, because it's so critical that they show their support for their employees to participate in all the fabulous wellness programming that we have. Getting people to maybe cut their meetings short now by just 10 minutes so that we can get up and move around is so critical. Those short recovery breaks are necessary to avoid this COVID-19 Zoom fatigue. Well, after the pandemic struck, our president put into place a scientific advisory group, which I had the privilege of vice chairing. Amy Karsh, the Dean of Public Health, chaired that. But I can't find another university in the country that has a goal through this pandemic to support, enhance, and sustain optimal mental health and physical health, along with the well-being of their faculty, staff, and students. Here at Ohio State, we are shifting our paradigm from sick care, which we're always going to need, but we are really focused on prevention and early intervention, including the building of these 9 resiliency skills. These are protective factors against the development of anxiety and depression. So I'm going to launch for the next 24 hours a resiliency activity challenge. And here's what I want you to do. I'd like you to take a picture of yourself while completing one of these resiliency components. Post it to our social website within 24 hours for your chance to win a Your Plan for Health point voucher. And I show physical activity here because it's not called out in the 9 resiliency factors, but we know many of us do choose physical activity as a resiliency building characteristic. It gets to our sense of purpose, and that is to remain physically healthy. I also want to briefly mention gratitude. I talked about this in one of our Stay Calm and Well series lectures, but we have so much research to show it shields us from negativity. People who practice daily gratitude are 25% happier. It rewires our brain, improves our sleep, and improves our relationships, as well as it increases dopamine and serotonin in the brain. Those are the same substances that are enhanced with antidepressants. So there's easy ways to practice gratitude. For those of you who are parents, if you can create a gratitude board in your house and get your family into the habit of waking up every morning and just writing down 2 or 3 people or things they're grateful for, it's going to have wonderful positive benefits. At our Safe and Healthy website, we have so much great information on how to cope with COVID, along with how to optimize your mental and physical well-being. We're in process with our Stay Calm and Well 2 series. This is so well attended by so many of our faculty, staff, and graduate students. We'll keep going with this series if all of you feel that it is helpful for you. As I conclude my piece of State of Health and Wellness, I just want to remind all of you, we have so many resources here at Ohio State to help you. Please take advantage of these particular resources. There is no shame to needing help. Also, it is not selfish to take good self-care. We cannot take good care of others. We can't do a good job unless we are taking a little time every day to take good self-care. We are 700 faculty and staff strong now as Buckeye Wellness Innovators. I cannot thank these people enough, and I can't thank the leaders for encouraging members of their team to be a BWI. We have 700. Our goal within the next couple of years is 1,000 across every nook and cranny of this great university. Please, if you're not an innovator now, there are so many benefits to being a Buckeye Wellness Innovator. Join us on September 21st when we orient another cohort. So now, before I introduce our wonderful Senior Vice President for Talent, Culture, and Human Resources, I want us to stop just for a minute. There's so much research that shows if we can get into the habit of taking just 5 big, mindful, abdominal deep breaths. And I like to do it once an hour all throughout the day. It's going to decrease our stress as well as decrease our blood pressure. So let's take just 1 minute now and take 5 deep breaths. Great job, everybody. Well, now I would like to introduce Susan Basso. We were so fortunate to recruit Susan from Penn State back in 2017 as our Senior Vice President for Talent, Culture, and Human Resources. Susan has such a fantastic track record as an HR leader who really drives strategic collaboration and organizational effectiveness. I can tell you from working with Susan, she cares about our entire Buckeye family, and she has been an absolutely wonderful partner for health and well-being. It's my pleasure now to introduce Susan.
Thank you, Bern. I so appreciate your partnership and the kind introduction, and really appreciate the work we do together to support a culture of health and well-being at Ohio State. And so appreciative I could join today. Even as leaders, we need those wellness recovery breaks that you referenced. First, I'd like to take a moment to thank all of our faculty and staff who continue to work through these unprecedented times. We realize how challenging it is to balance your health, your work, and personal responsibilities. I am so proud of the perseverance, resiliency, and dedication of all of you. Faculty and staff health and well-being is a top priority, especially as we face times of uncertainty and change. Human Resources, through your Plan for Health, has been able to reach thousands of employees to support them on their personal health and well-being journey. And we're proud to have partnered with colleagues in Buckeye Wellness, the Ohio State Health Plan, Employee Assistance Program, and the Gabby Health and Wellness Program. In addition to offering high-quality, affordable medical plans for employees and their families, we also provide opportunities for employees and their dependents to improve and sustain their overall well-being. The Your Plan for Health incentive program has had many changes over the years. In 2019, the program changed to offer quarterly opportunities to earn rewards. And since partnering with Virgin Pulse in 2018, we have seen great engagement. We've seen an increase in continued monthly engagement, as well as more people joining challenges. And this year, we have seen more people reaching higher levels and earning more incentives. This graph positively displays the year-over-year improvement in various health risks as measured by the annual health assessment. The red bar shows that individuals who consistently achieve levels 3 and above in the incentive program have a positive change in health outcomes. It shows that the more someone is engaged in the program, the better outcomes we are seeing as a university. We hope that through this trying time, our faculty and staff continue to feel how much we care through the resources and programs we provide. In the spring, we introduced a Keep Well webpage on the HR website with mental health and financial resources for employees and their families to receive individual personalized support either via text, telephone, or online counseling. Additionally, for 6 weeks, expanded fitness, mental resilience, financial well-being, and nutrition resources were available in the Your Plan for Health Virgin Pulse portal to support employees as they adjusted to a new way of life during the COVID-19 pandemic. We know these times are tough, and we are here to support you. I encourage you to take advantage of these resources and make your mental health and well-being a top priority. It's also been our priority to offer programs related to improving mental health through practicing self-care, mindfulness, and staying physically active. As we continually look for ways to reaffirm our commitment and increase engagement in wellness activities, this year we focused on virtual and digital programming, especially combining the many dimensions of wellness. In the spring, Your Plan for Health introduced a Step into Self-Care challenge that promoted walking and practicing self-care techniques. And there's currently a mindfulness challenge that encourages slowing down and being present in the moment. We are halfway to our goal of logging over 1.5 million minutes of mindfulness as a university. Self-care and mindfulness are very important components of overall health and wellness. And I've been pleased to see more than 10,000 of our faculty and staff engaged in utilizing these programs and resources. And reflecting a little further back, just this time last year, we were preparing for our 10th annual Team Steps Challenge, Hit the Road with Buckeyes. We had incredible participation with more than 7,200 faculty and staff walking a combined 4.9 billion steps, our highest participation ever in all 10 years of the program. With the many changes we've experienced this year, we've had to pivot and find a new way to offer our signature walking program. Now, we're preparing for a new fall walking challenge as we commit to keep moving forward, together as Buckeyes. More information will be shared in the coming months, and I hope you will join us. Thank you all for what you have done and continue to do, and thank you for being a community who comes together as teams and as colleagues. We are in this together. It is always so inspiring to see so many people share your personal journey with us. Throughout these challenges, you submitted photos showing us how you are stepping forward, staying active, and practicing self-care, whether on campus, at home, or around your community. Here is just some of what you shared. Thank you. And now I'm going to pass it over to Dr. Melissa Shivers, our Vice President for Student Life. Melissa serves on the university senior executive team and provides leadership and strategic oversight on matters related to the student experience. Although having just joined Ohio State in January, Dr. Shivers is leading the student life team through unprecedented times and was recently named as one of 40 higher ed leaders to follow on social media. Before coming to Ohio State, Dr. Shivers held the Vice President for Student Affairs position at the University of Iowa and has held leadership positions at the University of Tennessee, University of Georgia, Clemson, and her alma mater, Georgia Southern University. Melissa has held faculty appointments at multiple institutions and will be teaching a required diversity in higher education course for students in Ohio State's Higher Education and Student Affairs graduate program. She is a proud first-generation college graduate who is passionate about removing barriers to student and staff success, serving her community, and contributing to the world in ways that help to advance the health, education, safety, and security of others. She has already become a terrific colleague of mine and someone I consider a friend. Melissa?
Thank you. I really appreciate it. When I was being recruited to Ohio State, Bern was on my search committee, and I was excited to learn that we have a chief wellness officer at Ohio State, because the health and wellness of the team that I have the pleasure of working with, and certainly of our students, is a top priority for me. And so to know that we had leadership specifically around health and wellness and our well-being was really inspiring and encouraging. And I have not been at all disappointed in our institution's commitment, particularly during this time of a pandemic, and all of us, quite frankly, just trying to figure out how do we navigate these spaces and maintain our focus on our health and well-being. So thanks to everyone who helped put today together, and certainly want to thank Bern for her leadership and Susan for her tremendous and very kind introduction. Today, I want to be able to talk a little bit about my perspective as it relates to Buckeye strength through resiliency. The last few months have tested both our strength and our resiliency. I am proud to say that as a university, I think we have passed many of these tests with flying colors. I don't have to tell you that these are unprecedented times for staff and students. We're all feeling the difference and the challenges that COVID-19 has brought into our community and to our world. Next slide, please. In thinking about our core mission, and this is something that I share with my team in student life a lot, it's important for us to maintain our focus on this mission. And so in student life, the things that we talk about and how we describe what we do, we describe it in this sort of way. We believe that we are creating the extraordinary student experience. We are dedicated to providing it for all of our students, and that means whether they are here in person or not. Our responsibility doesn't change when we're online. It's simply just the methods and the ways that we go about doing the work. We continue to be focused on doing what we've always done, which is supporting student success, staying true to Ohio State's foundational and strategic positioning, and creating that extraordinary student experience for all students. Next slide, please. Relative to student health and wellness, we did a number of things in a very short amount of time last spring, and they've truly helped us with our approach this fall. Many of the student life departments pivoted quickly to offer programs and services virtually, many directly related to supporting student health and wellness. Rec Sports created a series of workout at-home videos. Counseling and consultation services put several of their most popular workshops online. The Student Life Student Wellness Center arranged for many of their coaching sessions to also be available online. Students could use Zoom for financial, nutrition, and wellness counseling, and they could also go through basics and CASICs screening online to assess risky behavior related to alcohol and marijuana. And we also, the Buckeye Food Alliance Pantry, ramped up their hours and donations to serve students that were in need. The PAL, the Peer Access Line, also stayed open for students who need a non-crisis place to talk and learn about university resources. We also did a number of special programs. While these are not all directly health related, they are a part of our overall effort to ease stress and anxiety for our students in a variety of ways. The student activities team did a series of workshops for student organizations on how to be effective at the same time following the health guidelines. Buckeye Serve, since they couldn't organize service trips, instead brought students and leaders from their usual destinations together to talk about service and opportunities that are still available. And then our Buckeye Leadership Fellows did a series of sessions for students who lost out on their summer jobs and internships. Next slide, please. This is a major pivot for student affairs staff. As you all can imagine, we spend a lot of our time sort of face-to-face, much like many of you do. But through the new world of Zoom, we are still finding ways to work very closely with our students, hands-on. And in ways that for a lot of them, this is how they've been interacting with the world for a while. And so we have found our path to be able to better support them. But it did require us to start to think outside of the box, but imagining a whole new world that has no real defined boxes. It is truly and was truly a seismic shift in how we approach our role. Next slide, please. And so one of the first things that we did, particularly because our Ohio State Student Life team is highly professional and quite frankly, one of the best that I've ever worked with, we realized that we just need to keep the momentum going. And that is actually where our resilience kicked in. We've given ourselves time to mourn the old reality. We've acknowledged that there's an unknown, and we faced up to how things are different and given ourselves space to adjust mentally and professionally. Where we were matters really less than where we are. We can't talk about the new reality. I've started to frame it as the next reality. And now, quite frankly, it's our time to prove our resilience during this period. Next slide, please. I was inspired by Michael Redd's speech earlier this month at commencement. He told grads, "You are indeed born for this time." He said, "Your perseverance and tenacity and drive will be the traits that will carry you into the next era of your life." True words, and true not just for our grads. They apply to every single one of us. We can look at this era through the lens of different is bad, or we can view it as an opportunity to rethink and revamp our approaches. It is certainly what our student life team faced in the spring and continues to face as we head into the autumn semester. It is also how we can be role models for our students. I would hope that they too would see Michael Redd's advice and seize whatever reality we find as an opportunity. Next slide, please. It is our resiliency that will ensure our success. That's true for our students, and it's also true for us. Our Buckeye strength is certainly centered in our resilience, and it is no doubt being tested right now. I also have no doubt we are up to the challenge. We will keep providing the extraordinary student experience in new, innovative, and scarlet and great ways. Thank you all so much for your time today.
Melissa, thank you so much. You have been such a phenomenal partner and colleague since you have joined us. I was jumping up and down when you accepted coming to Ohio State. So thanks to all that you and your whole wonderful team are doing for our students' health, well-being, and success. Now, we are going to focus on our 2020 Buckeye Wellness Awards. And I'm going to have Lauren, who is one of my wonderful Buckeye Wellness team members, join us to present the 2020 Buckeye Wellness Awards.
Good afternoon, everyone. As Bern said, I'm Lauren Batista. I'm a wellness program manager under the Buckeye Wellness Program, and it is my pleasure and honor to extend a warm congratulations to the winners of the Buckeye Wellness Innovator of the Year Award. We are consistently amazed with their ability to create and execute high-quality, innovative wellness programs and activities in their division, departments, and colleges. Creating a culture and environment of health and wellness throughout our university is a massive but valuable endeavor, and it would not be possible without the time, energy, and enthusiasm of people like them. So with that, I would like to advance our slides, and the winners themselves will actually tell you about the time and effort and energy that they put into creating a culture and environment of health and wellness across their divisions and departments and colleges.
Hi, everybody. My name is Rashmi Ganeth, and I'm from the Division of Hospital Medicine. And on behalf of our division's wellness committee, Christina Sadiq, who heads up our staff wellness, Purvi Dalal, Vig Doraswamy, Magdalena Danch, Neethu Abraham, and Marisha Goldsmith, we want to express our extreme gratitude and honor to accept this award. We're most excited to share that the BWI program has really inspired us to become more passionate about creating a culture of wellness within hospital medicine. It's given us tools and ways to be able to bring programming that is available to all faculty and staff to our division at a more personal level. And we are extremely committed to addressing the needs of our faculty and staff, and happy to feel that support from our institution as well. What it means to me is that I feel a part of something that's a greater part of our institution, and I feel like getting those tools to be able to use them to better our faculty and staff experience is only going to help increase engagement within our division. And that's a passion of mine, as I am the division's wellness officer. And I think, you know, to further express how passionate we are, we applied for 2 grants and we were able to obtain those, and that meant so much to us because we were actually able to give our faculty some real tools such as weights and mats, and be able to use those to participate in our programs. I have to specifically thank Dr. Mehran Mostafavifar for leading our workout sessions with our faculty and staff, and Christina for facilitating and heading up that grant and obtaining that grant. You know, it's just brought us all together during this time of COVID and quarantine to be able to share in COVID debrief sessions where we talk out patient cases. We've also empowered women faculty within our division with Women in Hospital Medicine Nights to help women achieve their mission statement and goals. We have established a mentoring committee within our division as well, headed by Dr. Karen Karignani. We have been giving our faculty these monthly wellness updates from the BWI events so they can stay in touch with what is there and offered to them in a form of support. And with that, I would like to pass the mic off to Christina Sadiq, who would love to say a few words of gratitude as well.
This award is an honor to me, and it means that it's possible to make a difference. I'm so grateful to work with the Buckeye Wellness Innovators and to work with such an amazingly diverse and collaborative group, such as our division's Wellness Committee. Working in this group has allowed us to focus on areas of wellness that interest us individually. We meet monthly in order to set these goals and to encourage each other. Even on the staff side, we strive to focus on the 9 dimensions of wellness, just like Dr. Ganeth mentioned. The programs I specifically work with Dr. Mostafafar is Muscles with Dr. Mo. which is a bi-weekly workout session, which we utilize our mats and our yoga mats and our weights. We have a Wellness Champion of the Week, which we elect a staff member that focuses on wellness for that week. Strength training with Dr. Mo, we utilize again those mats and our weights. Running with Dr. Delaw, which has encouraged me to start running weekly. We also have virtual workout sessions during COVID-19. We are striving to continuing as our regularly scheduled program. Healthy meals during division meetings, your plan for health and Virgin Pulse presentations to make it easier for the faculty and staff. Ordering standing desks for better posture and for a better work environment. I highlight these efforts on our division social media, Ohio State Hospice. Please follow us. Buckeye Wellness Advisory Committee is something I'm also engaged on, and I just remember sitting in on my BWI orientation back in December of 2018 and listening to a grant recipient, and I just was so moved by her program and what it meant to her. And I remember sitting there thinking, there's no way that I could never do that. And then here I am. With the help of the Wellness Committee, we're on our second grant. So I'm so excited. I'm so honored. I really appreciate this. Thanks, Dr. Ganeth, for pushing me. Thanks, BWIs.
I'm Jay Smith, an IT manager for School of Communication with ASC Technology Services. I've been at OSU about 10 years here. And this year I received Buckeye Wellness Innovator of the Year for 2020. It was a big honor to hear about this. I've been working really hard, collaborating with other Buckeye Wellness Innovators throughout the university, Lauren Batista, Josh Wynn. What we did was we brought a lunchtime yoga and meditation program to OSU for free. We do this in the 18th Avenue Library during normal times. However, during COVID, our main teacher, Geeta Sempath Kumar, has been running classes on Zoom. This award is very meaningful for me because, first of all, we're going through a huge crisis right now. And I personally know what it's like to be going through difficult times. And I've worked very hard to figure out how to overcome, anxiety, problems with depression through a balanced lifestyle as advocated by Buckeye Wellness. And this award is meaningful to me because it brings meditation and yoga to, it raises awareness about meditation and yoga at a university level, making people aware of all the offerings that happen throughout the week on the wellness calendar. So this has really changed my life, all of this stuff. And not just for me, we've had testimonials from 9 or 10 other people about how these classes at lunchtime are treating different conditions that people have, or just bringing a sense of wellness. To the reason I got into this, I've been at the university 10 years, and for 9 of those years I'd skip lunch every day, or just do something on the internet at lunch, the same posture you're doing the whole day. And I realized another 20 years could go by and the same thing is going to happen every year. I wanted to do something a little more meaningful than just relive the same year. So I thought if we brought in yoga and meditation and brought that in through the workday, my quality of life on any given day is going to be much higher. This award is especially meaningful for me personally because I'm leading a Ayurvedic lifestyle, meaning it's a lifestyle based around yoga where it's balancing physical postures with nutrition, sleep, exercise, meditation, self-care, spirituality, a holistic system that is not all that far removed from the 9 dimensions of health that Buckeye Wellness is advocating for. All throughout history, people who have been involved with spirituality have also been involved with living a holistic, balanced lifestyle. And now that we're dealing with a lot of electronics and stress over COVID and stress over moving to online, we need to take a step back and start taking better care of ourselves so that we can flourish in this environment and keep our heads above water when it comes to stress and challenging situations that come up for all of us every day.
I'm Geeta Sampat Kumar. I'm a certified yoga teacher. Last year when Jay approached me to conduct yoga classes for YSU employees, I was thrilled. I could see in Jay a passionate and motivated yogi who tirelessly worked to promote this ancient and more scientific art to YSU employees. I congratulate him on winning this year's Wellness Innovator Award, which he truly deserves. Thank you.
Thank you, everyone, for your time of viewing our efforts from our Buckeye Wellness Innovators. We again say congratulations. We hope you will join this amazing group of passionate people that want to make a difference in the health and well-being of our faculty and staff this fall on September 21st at our orientation. And I'm sure if you'd like the slides, you can certainly request them for more information on how to sign up for that orientation. And with that, I will pass the torch to our Director of Health Promotion and Wellness, Megan Amaya.
Thanks, Lauren. Hello, everyone. I am here to present the Manager Supervisor Awards. I am extremely excited and honored to present 4 Manager Supervisor Awards to the following people that you see here on your screen. It is so important for managers and supervisors to support the self-care journeys of the people that work for them, whether they're faculty, staff, or even students. We had a large nomination pool to choose from. There were about 400 people who were nominated for this Manager Supervisor Award. When managers and supervisors can support those around them, it can make all the difference in the world. Marcia, Adrian, JJ, and Laura, and just allow me a moment to share a little bit about each one of them from the nominations that came through. JJ makes it a priority to meet with his staff members on a regular basis to see how they are doing professionally and personally. He actually sends out some inspirational TED Talks for food for thought before their meetings. He's enthusiastic about the Buckeye Wellness Innovator Program and wellness as a whole. He allows the class or his staff to take yoga classes. Now, some of this stuff came in pre-COVID, but this was great information to hear about how he was supporting the wellness journeys of those around him. And there was a whiteboard in the staff office that people could post gratitude and inspirational quotes on. He certainly supports work-life balance and emphasizes shared workload to avoid staff burnout. Laura is a great supervisor for supporting work-life balance. She allows the schedules of her staff to be adjusted based on client needs and programming. And she actually wants her staff to practice stress reduction and movement throughout the day. And in turn when they have team celebrations, they have healthy treats at those team celebrations. She does a great job of creating a culture of health and wellness in her department. Adrian encourages her staff to participate in wellness programs offered by the university. She, again, supports work-life balance and encourages that flexibility throughout the day for those that need it. She helped start yoga in her office during the afternoon and encourages participation to keep it going. And she also participates and encourages her staff to get involved in health and wellness from the university partners that Bern has mentioned, and to take those breaks and promote stretching at the desk. And Marcia, our final winner, recognizes the importance of family and how it can play a role in healthy work environment, especially for those who have younger children, as Bern was alluding to earlier, the stress that parents can be under. So she's very supportive of the flexibility and the work-life balance, and she understands those challenges that parents face with younger children because she's been there herself. She's a big proponent of physical health. She wants her staff to participate in movement and to, when she's able to provide standing work desks for those around her. And she's an active participant in various challenges offered through Your Plan for Health. So with that, there are the awards that you see here in front of you. Each one of them will receive those in the mail. And thank you all so much for your support for health and wellness.
Thank you, Megan. I now am going to wrap up today's event by presenting our Executive Senior Leadership Award recipients. Both of these senior leaders are very near and dear to my heart as colleagues. The first recipient, so deserving of this year's award, is Dr. Rustin Moore, Dean of the College of Veterinary Medicine. Rustin was on a mission this year to really improve the health and well-being of his faculty, staff, and students. He created the Be the Model strategic plan with his team that incorporates evidence-based approaches, outcome assessments, and programming specific to academic healthcare professionals and vet students. His College of Vet Med's HPI index, as a result of what he invested in this past year, improved by 7%. He incorporated Health Athlete and the evidence-based MindStrong programs into his entire college. He is so deserving of this award. Rustin, I'd love you to make a few comments now.
Well, thank you, Bern, and good afternoon. Bern, I'll bet you would be glad to know that I've been standing here this whole program for about an hour and a half and also drinking my water. But first, let me start by saying thank you for this very kind and thoughtful recognition. However, because the work has been a true team effort, this award must be accepted on behalf of and shared with our college's faculty, staff, and students. They have worked tirelessly in a focused way to design and implement this comprehensive and integrated health and well-being program that you referred to, which is called Be Well. And this actually is centered around the 9 dimensions of wellness that has also been mentioned. And one of the goals is to also help to nurture a culture of caring. Health and well-being of our people is one of our 4 foundational principles for our Be the Model strategic plan, with the ambition to be the model comprehensive college of veterinary medicine in the world. The first of the 6 goal areas in the plan is culture and sustainability of our people, because our greatest resource is our human capital. Be the Model refers to a continual journey rather than a destination, and allows every member of our college family to participate and contribute to being the model at what they do. About 2 years ago, as you said, we embarked on developing the goals and components of this Be Well program. We prepared a request for proposals, which was sent out, and after reviewing them, our Health and Wellbeing Task Force chose the proposal and program that was submitted by the university's Buckeye Wellness Group. We are now beginning the 2nd year of that partnership, and as Bern and others can attest, and as she's indicated, we've seen some initial great results. This also includes incorporation of the MindStrong program, which we provided to our incoming first-year students with online virtual sessions, 7 45-minute sessions throughout the summer. And we've also required it, as Bern said, for all of our incoming interns, residents, because they are one of our most vulnerable groups of individuals. This has also never been more important and relevant than it is right now because of the challenges and uncertainties of the COVID-19 pandemic, because of the need to develop those coping and resiliency skills. For those of you who are not familiar with the veterinary profession, we sadly are one of the highest, if not the highest level of depression, anxiety, stress, distress, suicidal ideation, and suicide. This has become a crisis in our profession, and I personally have lost way too many friends, colleagues, and students to suicide, as have others. Because of the vitally important mental health resources and services that are needed throughout our college, we invested in health and well-being for our students, starting a few years ago with the hiring of 2 full-time on-site licensed social worker counselors, a part-time psychiatrist that's at the College of Medicine, and a financial advisor who helps work through our Office of Professional Programs. We also established the first College of Veterinary Medicine in the country to establish the Office of Career Management and Professional Development, and also an Office of Teaching and Learning and a peer tutoring program. However, we also needed to do more for our incredible faculty and staff regarding their health and well-being. And one thing we did is we piloted a program with the Employee Assistance Program, or EAP, to see if on-site availability of counselors in our college on a regular and consistent basis would be beneficial. We also began just recently partnering with EAP to provide You Matter virtual sessions that are intended to proactively engage our people, faculty and staff, in dialogue once per month, 1 session for faculty, 1 session for staff, to help provide a safe place for them to share their experiences, their feelings, their vulnerabilities, and to seek and give support for one another. And this is even more important now because of the social isolation caused by COVID-19. Our Be Well program also offers things regarding physical health, so that everything from walking, yoga, tai chi, meditation, arts and crafts, healthy snacks, and much more. And we will be establishing a quiet space and an activity room in our college, much like some of the other units across campus have done. In a college where we have a relatively small number of faculty and staff compared to the number of students and also the number of patients that we see in our hospitals, we need to find a convenient and accessible way to provide opportunities for faculty and staff and students to engage in activities that promotes their health and well-being. And this is necessary to help people manage and navigate the stressors and also prevent compassion fatigue, burnout, and other devastating effects. In addition to our comprehensive health and well-being initiative, we have also implemented a very robust diversity, equity, and inclusion program. And I firmly believe that this is important and directly related to the health and well-being of our people. We must nurture an environment and climate where everyone who comes onto our campus and through our doors, whether current or prospective students, faculty, or staff, clients or patrons, alumni, vendors, guests, and others, they must feel welcome, comfortable, accepted, safe, respected, valued, and a place they can be successful, satisfied, and thrive. Just like our Be the Model ambition is a continual journey rather than a destination, so is the work of diversity, equity, and inclusion, and health and well-being, and that work is never done. As such, we are implementing something called a house system this fall, whereby all of our students will be sorted into 1 of 4 houses, as will those faculty and staff who opt in. And each house has an animal mascot and 2 virtues or values important to our college. Another gap recently identified is the real transition of our graduates from veterinary school to their careers. And if you think about that, we really provide a lot of resources, as I briefly outlined, while they're here. But once they graduate, they go all over the country and to 40 other countries. We provide that comprehensive program here, but when they go out, it's really difficult for them to navigate, find the mental health and other resources that they need. So we are exploring a partnership with the Ohio Veterinary Medical Association and or others to offer a pilot program of regular virtual sessions with trained counselors, and perhaps this can serve as a launch pad for a broader and more scaled up version that could be more applicable to and helpful to the whole profession, which is again consistent with our Be the Model mantra. In closing, I want to give a special shout out to Dean Melnyk for her vision, passion, commitment, leadership, and her collaborative partnership. Brenda Buffington, Executive Director of Health Athlete and the Buckeye Wellness Program Manager, who is our incredible health and well-being liaison and energizer bunny, who motivates and inspires us. Josh Wynn, the Wellness Program Manager and co-facilitator of Buckeye Wellness Innovators. Sharon Saya and Suzanne Vickers with EAP, Dr. Jackie Hoyne, Director of the Mind Strong program, and all members of the Buckeye Wellness team who helped with the delivery of our Mind Strong programming, as well as our college's Buckeye Wellness Innovators, including my assistant, Jenny Ingraham, and also the past and present members of our college's Health and Wellbeing Committee, which includes former co-chair Dr. Ryan Jennings and our current co-chairs Amanda Fark and Dr. Jonathan Yardley. Thank you on behalf of our incredibly hardworking, committed, passionate, and caring College of Veterinary Medicine family. Health and well-being is definitely a team sport, and I accept this on behalf of everyone mentioned and all of our faculty, staff, and students. I said this at the beginning, and because of its importance, I'll repeat it again. Our greatest resource and asset are our people. We are fortunate to be at a university where its leadership values the health and well-being of our faculty, staff, and students, and aspires to help us become the healthiest university in the world. I must say, if you don't have one or more pets, get one now, because there are many evidence-based manuscripts out there about the tremendous positive health benefits on people of interacting with pets, whether physically, mentally, emotionally, or psychologically. So thanks for all you do. As Susan Basso was mentioning about the Hit the Road with the Buckeyes, I'm proud to say that last year, 2 of the top 3 teams in that were from Vet Med, and one of those happened to be the top team. So thanks again for all you do and your commitment to the total health and well-being of all of our people across Buckeye Nation. Thank you.
Thank you, Rustin. I really want to again congratulate you as a leader and your whole team for being so invested in your people. And I can attest to all the positive benefits of pets, because as everybody knows, and you heard them throughout my presentation today, I have 2 little character building pugs who create sometimes havoc in my household, but again, bring me so much joy. Well, unfortunately, Jean Smith could not attend today's event, but Jean is the other recipient of our Senior Executive Leader Award. And I will tell you that I often use Jean as an exemplar for a great leader who walks the talk and really supports his whole unit in athletics to be in their optimal state.
Hey, Bern. Gene is here. Let me get him in here for us. 1 second.
Fabulous.
Yep, I just promoted him to a panelist. Gene, you can get on your microphone if you'd like.
Excellent. Gene, congratulations on your leadership award this year.
Thank you, Bern. I really appreciate this recognition on behalf of my staff, my team that I work with every single day. And I particularly want to thank our Director of Staff Professional Development, Jerry Davis. He's done a marvelous job with our personal wellness programming that we've had in place for quite a while. Bern, it's good to hear you and see you. We've been good friends for a very long time, and all the way back to Arizona State. And, you know how passionate I am about creating an environment for everyone to make sure that they take care of themselves. No one knows yourself better than you, and health and wellness is so critical in all of our daily lives. So I accept this award on behalf of all my teammates that I work with every single day. I listen to all the award recipients, and congratulations. I think Jay Smith said it well. For all of us to achieve balance in our lives, there's so many things that we can take advantage of, and that should be a goal, to achieve balance in our lives. So congratulations to all the award recipients. And Bern, thank you for your leadership. I miss seeing you. I can't wait to our new next so that we can be in the room together. I just miss you so much. And you know that our athletic department was one of those areas that implemented the standing desk early. I think you saw mine. And there's just so many initiatives that you have been the motivator for and the inspirer of. So thank you.
Thank you, Gene. And I still show your photo as I go around and do presentations as just a model leader and supporter of wellness. We're so blessed to have you here in Buckeye Nation with all of us. So thank you so much to you and your team. I'm going to conclude by kicking off our 30-day Buckeye Nation Gratitude and Be Kind Challenge. I want each and every one of you to commit to just 30 days of making it a habit to write down 2 to 3 people or things you are grateful for every day, as well as to reach out with an act of kindness to one colleague every single day. We're going to share these on social at #OhioStateGratitude. Everybody, thanks for joining us today. Stay well, best wishes, and go Buckeyes.